Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Jon Allison, a psychiatrist from Saratoga Hospital and an adjunct professor at Albany Medical College. Welcome back to the show.
Thank you, Peggy.
We've already had you on the show for our show on depression, and today we're doing something different, which is anxiety. Do you just want to mention your background again?
Certainly, right. Prior to going to medical school, I got a degree in social work psychology and worked as a psychotherapist for about 15 years, which gives me a non-medical perspective somewhat, and then went to medical school and gained the sort of the medical pieces of the whole process.
Okay. And you have a story to tell that can describe the history of anxiety.
Well, I think right before we do that, I want to say that I think the anxiety is a good topic to follow depression, because sometimes I think anxiety is part of depression, and sometimes depression comes out of anxiety. But I guess the story that I use as a bit of an analogy to try to help patients understand where anxiety might come from is sort of a story that's probably part fiction, but also has some good grains of truth to it. I mentioned the idea of when we were quite young in our development as a species, that we probably coexisted with very dangerous animals in the wild. I always say the saber-toothed tiger, but my history is probably bad and we probably existed at different times. But imagine there was a saber-toothed tiger and you were a cave person and attempting to survive. It was a very difficult time. It was hard to find food. Oftentimes you were up against a lot of stressors. It was important for your survival that you be able to select for certain things that were frightening to you. And frightening in a sense that the fright would guide your behaviors in a way that would help you survive. So specifically, you hear the saber-toothed tiger roaring in the jungle, and instead of running, you're this very relaxed person who has no anxiety, so you stay put, and the saber-toothed tiger comes and has a nice dinner out of you. At that point, it's very difficult for you to pass on your genes and procreate, so that particular trait is probably not selected for in a genetic sense. Now, your cousin, who lived in the next cave over, responds by hearing the saber-toothed tiger growl, grabs his family, and runs and gets away. The flight, if you would, versus flight and fight, which we can talk about if you'd like, that cave person survives with his family. And the family grows up, and it has more little cave persons. And the cave persons are very sensitive and reactive to stress. They have a nervous system that hears a sound and learns that that is a dangerous sound, reacts in a fearful manner, and runs. So in a sense, it really was a positive thing. People survived because they were able to be, probably not in caveman terms called anxiety, but in our terms today, we might say anxious.
Right. So do you want to talk about the physiological effect of anxiety? What does it do to your body?
Sure. You know, the physiological piece really is an easy outtake from the whole story of the saber-toothed tiger and the cave person. The things that happen to your body are the things that would help you in that scenario. For example, you're going to need more oxygen to be able to do something. If you are cornered and need to fight the saber-toothed tiger, then you're going to need more power. If you're going to need to run with the little cave kids and your cave wife, then you're going to need to have a lot of energy available too. So things that happen are oxygen is shunted away from the skin and the surface and into the major organs. Your breathing increases, as people who are anxious might recognize, a shortness of breath. Your heart rate increases. There's a release of adrenaline, or epinephrine as we call it, all giving you extra energy and reserves to be able to respond to that situation. There's a tension that develops in the major muscle groups. And I hope I'm laying the groundwork there for kind of seeing that in the wrong scenario, i.e. one without a saber-toothed tiger, this could be a real maladaptive situation in terms of you might overreact to something that really doesn't require that your body be prepared to run away from a saber-toothed tiger.
Right. And we shouldn't be in that state 24 hours a day.
Exactly. And I
Not
guess
consistently.
right. I think
Only when there's a certain stimulus that we should react to, right?
well, I think the important part is that since we don't live with saber-toothed tigers, we have equivalents of them, and they may be a boss that we have trouble with, a coworker, it might be a spouse,
Right.
it might be the officer that decides maybe you're driving a bit fast on the Northway. So in a sense, they are our saber-toothed tigers, but the same level of response really isn't required for survival.
Mhm.
And I think where anxiety can become debilitating for people is when it's too strong.
Mhm. So why don't we talk about the different types of anxiety? There are some where I'm kind of confused between the difference between anxiety and fear.
Mm-hmm.
When you're, for instance, you're afraid to get on an airplane and fly someplace.
Mhm.
But that's anxiety, but that's fear at the same time.
Right. I think anxiety and fear often are used interchangeably. There may be some subtle differences, though. I think there's a continuum of anxiety. There are things that are your everyday sorts of perhaps worry or dread about something, or not looking forward to a difficult situation, which might be at the low end of the scale.
Right.
And as you step that up, you may get to the point where you feel a stronger sense of dread, where there's a palpable reaction, where you might feel your chest tighten, your heart beat faster,
Yeah.
you might feel your stomach, I think that there were butterflies in the stomach,
Right.
kind of turns over kind of thing.
Mhm.
And that works its way up to the point where at its extreme you could have a true terror type reaction where you just are absolutely paralyzed. I would say the deer in the headlights phenomena, where it's
Right.
such an absolute stark terror that you're unable to really respond. In between all of those are other things like a generalized anxiety, where someone is unable to really identify a specific stressor, but has this general free-floating sense that things just aren't right.
It's kind of like who we would call a type A personality.
It's possible. There's some overlap with that. I mean, there's a whole continuum of anxiety disorders, which I'd say are probably driven by a nervous system that reacts relatively easily. Back to our story, it was one of the survivors from the saber-toothed tiger era
Yeah.
that was able to get by because they did react to things very easily. But sometimes we need to not react to things today.
Right. Do you want to talk about Albert Ellis and his theories?
Sure, I'd be
You're a
happy
big
to.
fan of him, right?
Well,
he just
I-
died
I'm
in
a
July.
I'm a big, yeah, maybe that's why I'm a fan, because certainly he's contributed an awful lot to psychology. I like some of the ideas that he has, because for me, when I speak with patients, it gives control back to the patients. It's really a form of cognitive therapy,
Right.
which the gist of it says that we're smart enough to figure out how to think about what we feel, and by changing how we think, we can change how we feel. And that's the gist of it. I think you have a great quote that perhaps would really kind of sum up some of Albert Ellis's thinking. Maybe we can talk about that later. But
Mhm.
in essence, Albert Ellis came up with an ABC theory, and he talked about these, A was activators, and that were the things that happened in your life. Back to our story would be the growl of the saber-toothed tiger.
Right.
And then the C, the outcome of all of that, would sort of be how you reacted, what type of feeling that you experienced. It might be stark terror for the person who reacted, and
Yeah.
it might be nothing for the person who was lunch for the saber-toothed tiger. Well, Ellis was somewhat unique in a sense that he inserted B between A and C, which would be logical. And B were beliefs. And his idea were that your beliefs controlled a lot of how you would react. If your belief was that that sound was a misinterpreted babbling brook nearby and you didn't need to react, your reaction would probably be to sit there and end up being lunch. If your belief was that scary sounds you'd never heard before was something you needed to react to, then you probably survived. So we could probably come up with some other examples of in modern day how we think about a situation really determines how we're going to feel about it.
Right. Like you have the activator of waiting in line at the supermarket,
Right.
and there's a long line,
It's a great example.
and then you have your beliefs, and then you have the consequences, or what your
Mhm.
reaction is.
Right.
Some people really get very upset, and some people just stay calm and wait until they're waited on.
If you
But it's all dependent on B, right?
Well, I think B is a big part of it. And I think if you were in that situation, or say I was in that situation, and I'm facing this big line, a lot of times how I choose to interpret that scenario, the B, is going to determine really how I feel about it, C.
Right.
One approach would be, you know, it's a big line. There are big lines everywhere. There's not much I can do about it.
Right.
I do have choices. I could put my things back. I could leave the cart at the front of the store and get in a huff and walk out. Or I could perhaps wait in line and think about other things and distract myself by reading the tabloids that are usually up front, or maybe find a candy bar or watch people. And those things would be different. I wouldn't then react in a very anxious or angry way. The other things I could say would be, this isn't fair. This isn't right. Why does this always happen to me? Oh no, I can't believe this. Now each one of those would elicit probably a more irritable or an angry or anxious type response. And at that point, that feedback comes, because now your body starts to get tense.
Right.
And you pay attention and you realize that the muscles in your neck are getting tight. You may be breathing a little bit different. You're clenching your jaw up. And then that tells your mind that, you know, this is really kind of an irritating situation, which really starts a whole self-perpetuating cycle of irritability and anxiety ultimately.
And I think it's also interesting, the B's, like, let's say you're a very laid-back person, and you don't really care if you get back to work late. Then you're not going to have a C, and you're not going to react.
Right,
and you're just going to wait until you get through, unfortunately.
Well, and I think that's interesting, because the B's may have an awful lot to do with those people who are more chronically bothered by situations and those that aren't. And I'm not trying to interpret that there is a correct way to respond, because we all have personalities, and I think there's a place for people who are certainly more attentive to their surroundings, and maybe we would call those more anxious people. But there's also a place for people who are more relaxed and less attentive. As I work with patients, I really use a different B, the idea of balance often. And the idea is that there are some things worth reacting to. Because, you know, if you start to step out in traffic and the light wasn't in your direction and you hear a car horn honk, it's a good idea to jump back. Because if you don't, it might really be an uncomfortable situation, to put it mildly. So those are things that you should react to, in a sense. There are other things that just really aren't worth reacting to that maybe you don't have control over. And those are things you probably need to step back from.
Right. But I also think it has to do with how your day is going that day. Well, let's say you had 3 bad things that happened earlier before you went to the supermarket, and you didn't sleep well the night before. That's going to affect how you react when you're at the supermarket.
Certainly,
right?
Absolutely. And I would say that those are the preloads, if you will, the things that set up the context for how you're going to interpret a scenario. If you go into a scenario with perhaps a lot of stress to begin with, you're already loaded in the direction of making a negative interpretation. And I think to combat that more effectively requires that you be aware that you're going into a situation perhaps more loaded toward the negative than you need to be. And I think at that point you need to counter with more of a B that's perhaps even the other way, saying that to find the middle point here, I'm going to have to really push to kind of try to relax. Certainly the ABC theory doesn't solve all anxiety. There are a lot of reasons to be anxious, and there will be anxiety, even regardless. And I think we need it. It's not something we need to get rid of completely.
And somehow, how does your body adapt? Let's say you face the same activator 10 times. Like I've done 20-something TV shows, and the first time I did it, I think I was a lot more nervous than now. But somehow your body gets used to that.
Well, I would maintain that probably if we could get through that somehow, we could figure out that your beliefs probably changed slightly. And that if with the first television shows, there were probably more beliefs centered around concern about perhaps how things would develop. Would you be able to ask the right questions? There may have been things that for you were beliefs about the situation that might have made more anxiety. With rehearsal and practice, you become more comfortable, and the beliefs may alter to, I do need to do an adequate amount of preparation, but you know, I don't have to be as worried about how things develop, because chances are it's going to go okay. So in some ways you would have altered your B. But I do think there's a practice effect, and what we're kind of skirting on here are a lot of treatment potentials in terms of helping people to deal with anxiety, is by looking at those kinds of scenarios, sometimes in fact finding and identifying those things that make you most anxious and working through. Practice is one thing, and you mentioned that, say doing a series of television shows is practice. There are other ways that people can rehearse doing things that are frightening to them. There are ways that people can approach stimulus that usually elicit a strong response. Say, for example, a person who has a phobic type fear, which we didn't talk about specifically, but say a fear really centered around one thing, like a spider, for example.
Right.
That there could be some ways of successively approaching that stimulus that's frightening in a way that helps people to detune their fear from it.
That's interesting. So you're a big fan of Albert Ellis, and I have a few quotes, but one of them, which was interesting, was people don't just get upset, they contribute to their upsetness.
Yeah. I think that one really captures the whole gist of what I'm trying to say here, is that would be the B part, that people contribute, and we all contribute in some way. With the caution I'd throw out that we don't need to blame ourselves for anxiety either. What I'm saying is take back control of the part that you can. We can't control some of the frustrations in our life, but we can control how we react to some of them. It's not a given that you have to be upset about everything that happens to you. Now, in some cases, in general, we might say 99% of the people would choose to react in a very negative fashion to the death of a loved one, to something that is horrifically tragic. And I think those are things that we share both culturally and as a species. Those things aren't appropriate to say, well, let's change how I feel about that by changing how I think, because those things are more general in a sense. But when it gets to smaller things, like the spider or waiting in a line at a grocery store, those things are amenable. Perhaps it's a frustration of a job that's not entirely satisfying.
Right.
By changing a belief system, you empower yourself in a position that you could make a change. If you say to yourself, I don't have to be stuck with this, maybe it gives you the freedom to look at other alternatives. Say I could find a different job. Maybe I can go to a different grocery store. Maybe I could go at a different time when there's not a big line.
Do you have any suggestions on how to deal with an anxious person? Like, let's say in a customer service situation, you're the cashier and the person's been waiting for 10 minutes online.
Well, it's kind of interesting that you bring that up, because actually when I was in graduate school I was a cashier, so I can relate in kind of a personal way. But I think good customer service training is often at its root is probably some sound psychology. And that is, when people are anxious, it helps to understand why they might be anxious.
Right.
And to identify with that in some way, and to say, and to acknowledge that. I think it's important. People need to feel acknowledged. And I think in handling an anxious person, recognizing that they're anxious and helping, sort of normalizing that in a sense, saying, I'm sorry you waited so long, it must be difficult waiting like this, and sort of letting that person ventilate some of that frustration that they might have. That's one way. But if you're up against somebody who's really got chronic anxiety, there may come a time and place where treatment might be necessary, where you might really need to talk to somebody sort of outside that scenario. And that, I think, we would pull away from the idea of a clerk and somebody frustrated in the line. We're talking about when anxiety becomes more of a debilitating presence in your life, when it starts to really interfere.
So, like, for instance, anger management. Somebody gets very angry in situations.
Exactly.
Or somebody doesn't want to leave their house because they're afraid of something outside.
Right. And anxiety can impact negatively in a lot of different ways. It can be a very minor thing that you can easily sidestep around. If it's a fear of public speaking, you certainly can take a job where there's very little public speaking. If it's fear of travel, perhaps you can minimize your travel. So anxiety in a lot of ways is more open to alterations of your own, in a sense of, I call it titrating your experience, sort of an approach avoidance piece that you can pull back from a lot of things that make you anxious. However, if you have a generalized anxiety, it's free-floating. It really is just out there and you feel anxious. That's very hard just to pull back from specific things at that case. It also may be that if your anxiety is around a certain area, maybe it's around human contact, more of a social anxiety, that might interfere with some of the things you'd like to achieve in your life.
Right.
Relationships, success in different types of careers. And at that point, I think people need to look at how is anxiety impacting them, and then maybe talk to somebody about it.
And basically the cognitive approach to therapy, is that more having somebody in for therapy as opposed to medicating in general?
Cognitive therapy is one of the few real therapeutic approaches that is able to have some scientific basis. That means you can do some studies with it and see there are certain techniques that seem to have effects. It's not contraindicated along with medication at times, but it can be effective on its own. Sometimes the best is both, and it's going to depend on the individual circumstances. But cognitive therapy is a great technique. It's a great way of taking control back of your life, of looking at situations, seeing if there are other ways you can react to them, and then keeping track, having some kind of feedback system that really allows you to see, are you making progress? And sometimes that in itself helps people a lot.
Do you think that keeping a journal is helpful?
I think I would like to be able to say that we should all keep a journal. Do I keep one? Honestly, I haven't. Would it be helpful? Probably so. The piece I think is helpful about it is that it allows you to externalize your thoughts and feelings. And it isn't so much the putting them down as it is sometimes going back and seeing that, a few weeks ago, a few years ago, maybe this was in place, and now I feel this way. And there's a difference in some ways. So it can be a marker event. It also can be a way to make your feelings more objective, less subjective by putting them out. A lot of therapists make use of journals. I like to suggest that often to my patients. Whether they share it with me or not is sometimes optional. There are patients that want to share their journals and say, doctor, I want to bring this into you and tell you, this is how I was feeling then, because I can't always bring it to the session in words, but I can bring this to you.
Mm-hmm.
And that's fine. But there are other patients that really feel it's important that it be a private thing, sort of the diary of old when, a schoolgirl's diary or something that's private with a lock on it.
Well, the interesting thing is that with the advent of the internet and blogs and MySpace and all of these web pages, people are now documenting their lives in diaries and journals online for anybody to read.
That's true, and I might have some of my own personal opinions on that, and it's probably my bias because as a psychiatrist I tend to see everything as from a psychiatry bias. When you're a hammer, everything's a nail. So as a psychiatrist, there's always something sort of psychological out there. But I think in some ways maybe it's an attempt to express, an attempt to join, an attempt to let others know of your experience and to share.
Mm-hmm.
I think as humans we need that. There's a need for connection somehow. And we could argue the morality of it in some cases, or we could argue, is it real connection? But those are things I think haven't been sorted out yet. But we have a need, and there's something there that people want to talk about their experience in life.
But the thing that scares me is that people may think that they're getting their therapy from their friends online when it's not a professional
Mm-hmm.
opinion. And they're taking that, whatever these people are saying, to heart as advice.
Right. That's a good topic. My fear would be that when you can find a group that thinks and feels the way you do, you can normalize just about anything. And the problem is, in the past, we had certain social norms that our society enforced, and that you knew certain things were too far outside the line, and you just don't do that. But if you've got some kind of weird interest in spiders that nobody else in your neighborhood shares, I use sort of a non-dangerous type of thing here, but you find a website group that's people who are really into spiders. It's an amazing thing. And before long, you start to exclude people from your life who don't share those kinds of feelings. So now you've normalized this desire to spend time with spiders and to research, and perhaps you get too far into that. Now, that's an innocent example, but there are very serious examples. Very serious examples about websites for young girls who think that they're overweight, and it's look at anorexia as a positive thing. And I think that's very scary. If you find other people who share a belief system that's destructive, what you do is you reinforce that. Kind of the concept, if you have a problem with alcohol and you go to the bar, you can probably find people who will tell you don't have a problem with alcohol.
Right, who tell you you're okay.
Because some of them may have problems as well. So if you normalize things, and it's tough on the internet because things can be normalized that aren't necessarily normal and that we don't want to have normalized in our culture.
Mm-hmm. So what do you think about the difference between how we perceive our own actions and how somebody close to us perceives our own actions?
Well,
why is there a difference?
Well, I think we're inside ourselves, and you want to say the forest and the trees argument, that that we do have a unique place in ourselves to be able to really have a sense of what's going on inside. But there's a part for reality testing as well. And I like to use an example of a balloon, a hot air balloon that's tethered to the ground. If it's not tethered to the ground, whatever the wind does is where we go. And I think of the tether as your connection to reality. And some people really reel that rope out a long ways, and that balloon is floating out a mile or two from where it's anchored. But if it's still anchored, you still are in touch with what's happening around you. The anchor, I think, for all of us is the feedback we get from other people. And that can come from society, it can come from people that are close to us. Because when one person says to you, Peggy, that's really off, you may say, maybe they're off. But you know, 2 people say it, 3 people, 4 or 5, and then you start saying, you know what, whatever I'm doing here, I need to look at this. And that's the sense of being anchored. That's the sense of maybe I lost touch, maybe my balloon floated down too far, and I need to sort of get an anchor back and pull myself back in. That's reality checking, reality testing.
But I guess I'm wondering about the difference between reality of how we perceive ourselves. Like, let's say we're answering the anxiety scale questionnaire online, and maybe our loved one would say, that's not the way you are.
It's difficult because we all have an investment in seeing ourselves certain ways. And I think that we tend to construct our self-esteem around a certain identity, a certain idea of who we are. So others may not see that entirely the same as we see it. As long as that gap isn't too big, and I go back to the tether for the balloon, as long as that isn't really reeled out there 100 miles or so, it's probably all right. But if you're taking one of these scales and you're coming up with an answer that is dramatically different than somebody who sees you regularly, it probably needs some interpretation. And at that time, it might be helpful to talk to somebody else who's a little more neutral in this situation.
But I think maybe the situations where I see it more often is more addiction than anything else. Like you mentioned with alcohol, no, I don't have a problem, and I don't do it very much. So that's sort of...
I guess you brought up the big word with the big D, the big denial, which is a huge part of a lot of things that we as humans do. Denial is not inherently negative. It is, however, inherently negative when the difference between how you perceive yourself and others perceive you is so far, say the gap with the balloon, that it allows you to do things that are dangerous. And I think that's where reality has to come back in somewhere.
So you've mentioned a few types of treatment. Medication is one of them. Do you want to talk about that?
Sure, I can talk about that a little. Anxiety is difficult at times to treat with just medication. It's often tied together with depression in some ways. So many of the drugs that I would use to treat depression are often effective with relatively mild cases of anxiety. There also are some other specific medications that really not long-term but might help somebody get through a short-term scenario. I really like the idea of using feedback to people as well, which would be sort of monitoring that physical response you might have to a scenario and then altering that, along with the cognitive, which would be looking at what the B's are, what the belief system is that's in between what's happened and how you're feeling, and keeping a log and altering that and seeing how it affects the outcome. I think those are ideal ways. Medication can be a slippery slope that isn't always helpful, because if you use a medication that's a tranquilizer based, then it really starts to, it works. It subdues your anxiety. So does alcohol. And I think to become overly dependent on that doesn't really solve the problem, but it does help with the symptom. I think what we need to do is look more at solving the problem rather than treating the symptom. Early on, I will be happy to treat a symptom to help somebody get back on their feet. And I think that that has to be a gradual transition from reducing the symptom through an outside means to reducing the symptom from an internal means.
Do you ever get somebody just coming into you saying, hey doc, I just want some of this medicine and I'll be on my way?
Absolutely. And what I unfortunately or fortunately end up saying is that, you know, I'm probably not the ideal physician for you. This might be my psychology background, but I think it's really important that we talk about things, we understand things, that you understand things, and that if medicine plays a role, I'll tell you. I certainly will be happy to discuss that with you. But I think if you're looking to numb yourself to life, that wouldn't be an approach that I would follow. I think people have feelings for a reason. I think that we react to hearing sounds in the jungle for a reason, that sometimes we should run.
Right. So what about HMO reimbursements? Is that challenging in your field?
It is. I think it's challenging to all of medicine. And to try to be neutral about that, really they've asked that we be accountable for what we do. They've asked that we show that what we're doing is effective and that it has a purpose and a place. At its worst, perhaps, it has the effect of diminishing people's access to treatment, or perhaps shortens the length of treatment that might be more effective. There's a balance, I think, also as well. As a medical professional, I don't think I need to be threatened by somebody saying, you know, Dr. Allison, show me why you're doing this, and does it work? I think that's okay. It's okay to ask me to show you things and to say, why does this work? What is difficult is when you decide, you know, I don't think this person needs this, and you're not necessarily in a place to be able to make that call.
But the other thing is that you can't really show scientific evidence like a blood test or an X-ray that says this person has this disorder.
Right now, you're right. We don't have things specifically. What I have are words, and of course words are often difficult to portray something, but if I can tell you that someone who didn't leave their house for 2 or 3 weeks is now able to go grocery shopping a couple days a week, is able to function better in society, and now maybe hold a part-time job and contribute, we've done a lot of very positive things. And that, in a sense, is toward a measurable goal. Something that isn't a blood test, but yet something very real. And I tell you, if you ask that person who's doing that, they will very strongly tell you it's a big difference.
So to finish, you just wanted to mention a few websites. Of course, the big one is the American Psychiatric Association.
Absolutely. And that's the one that I would start most of my search. The internet is a wonderful tool, but anything you want to find is there. And if you want to find it, it would be there.
Just make sure it's authoritative. That's all I'm
saying.
As a librarian, that's what I'm saying.
And I think that's a great piece that you bring to that. The American Psychiatric Association is the medical bottom line on psychiatry and psychology. There also is American Psychological Association that I think has a lot of good things available, a lot of resources. There are links and websites also from there. I think the benefit of going to a body like that to start your search is that they've done some of the selectivity already. They've screened. And if you follow those links, you're likely to end up to things that actually have a good degree of medical credibility to them.
And you also mentioned to me earlier, the National Alliance for the Mentally Ill.
That's a good website because it helps to know, it helps to give information, I think, to patients about what questions maybe to ask practitioners. Now, when we use the term mental illness, oftentimes people get a bit of stigma attached to that. You know, they think that this is going to put them in some category that has a particular negative stigma to it. So I think that term maybe needs to be updated, but I think it's the idea of somebody who struggles with some difficulty that has a mental origin.
Okay, so the last thing I wanted to finish up with was one other Albert Ellis quote, which I thought was interesting. The best years of your life are the ones in which you decide your problems are your own. You do not blame them on your mother, the ecology, or the president. You realize that you control your own destiny.
It's a great quote.
Thanks very much for coming. Perhaps we'll have you back for a show on a different topic in the future.
Well, we've mentioned a lot of topics, so there will be a lot of places we could go.
Yep. Thanks very much.
Thank you.
Thanks for watching. We hope to see you next time on Focus on Health.
Welcome to Channel 17, the Town of Colonie Government Channel.